Good evening, everyone. Yeah, this side Dr. G, and today we are going to discuss a very important topic: the inguinal canal, inguinal hernias. I will have a little bit discussion about the spermatic cord and the contents of the spermatic cord. Okay. I will discuss about the mechanisms that are involved in the inguinal canal. So yeah, before starting with today's session, I would like to get a thumbs up from everyone here who is present. Yes, so just to indicate that the audio and visuals are perfectly fine. So yeah, please. I hope the audio and visuals are perfectly fine. Just give me a thumbs up in the chat box so that I can start. Garima, okay. Welcome, beta. Angel, welcome, beta. Good evening, beta. Yes, Hussein Sayed, welcome, beta. Yeah, चलिए चलिए perfect guys. बाकी सब हैं जिंदा है ओके चलिए let's start. Sai Krishna, good evening beta. Let yeah. So we are going to discuss a very important topic और अगर ये समझ में आ जाता है तो obviously इससे क्वेश्चन आता है हर बार एग्जाम में. This is an important topic for the exam point of view also, right? So let's start with the topic, that is the inguinal canal. Okay. Now before discussing the inguinal canal बेटा, canal का मतलब क्या होता है? Opening होती है, एक passage, एक pipe like structure होता है. Canal का मतलब तो सबको पता ही है ना. So yes, canal का मतलब तो you already know, it is just a pipe like structure. ये एक pipe like structure होता है. So yeah, canal opening है, ठीक है, which is having opening at both the ends, right? So you guys already know. Hello, Kapil Ahmed. Good evening, beta. Sarishta, good evening, beta. Good evening, beta. Welcome to the session. Please be with me throughout the session because I'm gonna discuss very important topic today, right? So yes, without wasting much more time. Now, beta, you already know during the descent of the testis, okay, during the descendant of the testis, okay, the testis has to like go through the abdominal wall, okay. Now, it has to go through the abdominal wall and to reach the scrotum, right? Along with the scrotum, it has to go down. Now, testis, while descending downwards, it has found certain space, okay, some space in the abdominal wall, right? And through that space, it is going down, okay, and that space it is called as the inguinal canal, and that space it is called as the inguinal canal, okay. Now when I say inguinal canal beta, you have to understand first that it is a, yeah. Now if we just talk about the definition beta, what is actually inguinal canal? So remember, it is an oblique. Now beta, it is not straight. Remember beta, it is oblique. Yes, it is oblique. Intermuscular passage. Okay, it is situated in between the muscle. When I say inter means it is situated in between the muscles beta. Intermuscular passage, right? It is an oblique intermuscular passage in the lower part, okay, in the lower part of the anterior abdominal wall. In the lower part of the anterior abdominal wall. Okay. In the lower part of the anterior abdominal wall. So this passage, okay, this passage is actually going to transfer the spermatic cord in males and the round ligament in females. Okay, this passage is going to transfer the spermatic cord in males. Okay, so it is transmitting the spermatic cord in males and round ligament in females. We'll come to the contents of this canal later on, but as of now, just remember it is transmitting the spermatic cord in males and round ligament, okay, in females, right? Round ligament in females. Now, beta, before coming to it, you should remember, okay, what is the site? What is the site or where it is located? What is the site or where it is located? Now, beta, see over here. Before coming to this particular picture, this Daravna wala picture, let us first understand through a schematic line diagram, and then I will come to this picture also. then I will come to this picture also. Now, when I say, yeah, what is the length of this canal? What is the length of this canal? Anyone? It is 4 centimeter beta, approximately 1.5 inch. It is 4 centimeter, approximately 1.5 inch. Right? It is 4 centimeter, 1.5 inches. Right? Now, you already know, you guys already know that this is the anterior superior iliac spine. Now, see where this canal is present. You already know this is the anterior superior iliac spine, and from the anterior superior iliac spine and till the pubic tubercle, right? Till the pubic tubercle, you already know we have this. Which ligament is present, beta? Which ligament is there in the chat box? Which ligament is present, beta? You are very well aware which ligament is there. This is the inguinal ligament, right? So this is an oblique ligament. Straight nahi banana beta. It is an oblique ligament, right? So this is inguinal ligament, right? I'll just mark it over here. Now, I'm just trying to specify the location of this canal first. So this is, you already know, this is the inguinal. Yes, everyone is right. Fun mode, dimple, Kapil, very good. It is the inguinal ligament, right? It is the inguinal ligament. Now, inguinal ligament. Now, beta, this canal. Now, let me just draw this canal, beta. So remember, beta, this canal, it is situated. बेटा एक पाइप है, एक पाइप की दो ओपनिंग्स होती है, ठीक है, एक कैनाल है, इसकी भी दो ओपनिंग्स होंगी बेटा. One opening, okay, that is the deep inguinal ring. This opening, it is called as the deep inguinal ring. And yeah, we have another opening, and that is like this triangular shaped opening. So that is the superficial inguinal ring. So this is like this, right? This is like this. So yeah, this is the deep inguinal ring. Okay. So yeah, let me just correct it. Hmm. It is the deep inguinal ring. I'm just trying to know, show this canal where it is present. Deep inguinal ring. Yes, Abugar, yesterday in the Telegram group, definitely. Deep inguinal ring. And this is the superficial inguinal ring. Superficial inguinal ring. Now it has two ends, right? The deepest part, it is the deep inguinal ring, okay, and we have the superficial inguinal ring, right? It begins with the deep inguinal ring, okay, and it ends with the superficial inguinal ring. Now, where this canal, okay, this inguinal canal is present, beta, everyone knows that. For example, if I'm taking this particular line, इसका मिड पॉइंट ये होगा, ओके, इसका मिड पॉइंट ये होगा. Similarly, the midpoint of inguinal ligament, it will be called as the mid inguinal point. Okay, it will be called as the mid inguinal point, right? Inguinal ligament का भी एक mid point होगा, that will be called as the mid inguinal point, right? So this canal, it is located 1.25 centimeter above. Okay, this is located 1.25 centimeter above this mid inguinal point, right? So this is located 1.25 centimeter above the yeah, inguinal, mid inguinal point. So if we talk about the site, beta, site के लिए you should remember it is situated just above the hmm, just above the mid, or you can say it is situated (1.25 centimeters above the mid-inguinal point. Mid-inguinal point. इतना क्लियर है सब लोगों को? फटाफट से एक थम्स अप दे दो कि हमें पता चल गया इसकी लोकेशन कहाँ पे, इसकी लोकेशन कहाँ पे है। तो यस, हमें पता चल गया कि इंग्वाइनल लिगामेंट होती है और इंग्वाइनल लिगामेंट का जो मिड पॉइंट होगा दैट विल बी कॉल्ड एज द मिड इंग्वाइनल पॉइंट एंड इट इज जस्ट सिचुएटेड अबव तो दिस इंग्वाइनल लिगामेंट। अब बेटा इस क्वेश्चन का भी आंसर दे दो। इफ आई एम सेइंग इट इज सिचुएटेड अबव द मिड इंग्वाइनल पॉइंट, ओके, इसकी बाउंड्रीज की अगर एक क्वेश्चन पूछो तुम लोगों से, व्हाट विल बी द बेस ऑफ दिस इंग्वाइनल जो कैनाल है, इसकी जो फ्लोर होगी उस फ्लोर पे मुझे क्या मिलेगा? What I will found at the floor of this inguinal canal? Anyone? Dimple D, Garima, Angel, very good. Very good. What I will get at the floor, beta? What I will get at the floor? Inguinal ligament. Very good. Very good, beta. अब मैं बोल रहा हूँ कि इसके ऊपर है, तो ऑब्वियसली बात है इसके नीचे तो मुझे आई विल गेट द इंग्वाइनल लिगामेंट ओनली ना। 1.25 सेंटीमीटर ऊपर है तो इसका फ्लोर जो है इस कैनाल का, उस पे मुझे क्या मिलेगा? इंग्वाइनल लिगामेंट, राइट? आई होप दिस पिक्चर इज क्लियर इन योर माइंड, ओके? I hope this picture is clear in your mind, okay? Now, coming on to the other part, beta. Other part over here. That is, what is the direction? These are all the questions that have been asked. These are all the questions that have been asked. So, yes. सब पे स्टार मार्क या डॉलर लगा लो, सब पे स्टार मार्क या डॉलर लगा लो। व्हाट इज द डायरेक्शन बेटा? अब आपको खुद पता है बॉडी का मिड पॉइंट जो है, बॉडी का मिड पॉइंट जो है, इट इज दिस। बॉडी का मिड पॉइंट ये हो गया, बॉडी का मिड पॉइंट ये हो गया, राइट? तो दिस इज द मिड पॉइंट ऑफ द बॉडी। तो अब ये देखो इसका डायरेक्शन कैसे कैसे ये ट्रैवल कर रहा है। व्हाट इज द डायरेक्शन ऑफ दिस कैनाल? नाउ डायरेक्शन ऑफ दिस कैनाल, इट इज डायरेक्टेड डाउनवर्ड्स, ये नीचे की तरफ आ रहा है। It is directed downwards, okay? It is coming towards the medial side, okay? It is coming towards the medial side and it is coming towards forward, ठीक है? ये पीछे से आगे की तरफ आ रहा है, ओके? और ऑब्लिक है ना बेटा, तो ये लेटरल से कहाँ जा रहा है? मीडियल की तरफ, ओके? लेटरल से कहाँ जा रहा है? मीडियल की तरफ। सो डायरेक्शन क्या हो जाएगी? डाउनवर्ड्स, डाउनवर्ड्स, ओके? फॉरवर्ड्स एंड मीडियल, downwards, forward, and it is medially coming. Okay, so I hope this is also clear. The site and the direction is clear. बेटा फटाफट से एक thumbs up दे दो जो भी लेक्चर देख रहे हैं। चलो, वेरी गुड। नाउ अब हम लोग इस पूरे कैनाल को, दिव्या श्री, नागी रेड्डी, वेरी गुड बेटा, टिम्पल डी, साई कृष्णा, वेरी गुड, वेरी गुड, एंजल मैथ्यूस, वेरी गुड बेटा, वेरी गुड। इट्स very important that you guys are listening and like understanding simultaneously. It's very important. Now guys, we will discuss about these openings now. Okay, we will discuss about these openings now. Yeah, so everyone knows that it is, yeah, everyone knows that, yeah. Yes, Garima Shiv, very good better. Everyone knows that this. Now if we talk about, yeah, the beginning part, okay, or if I say the beginning part, beginning कहाँ से हो रही है बेटा? beginning कहाँ से हो रही है? तो beginning it is taking place, okay, I'll just draw it, yeah. So beginning, you are already aware of the fact that beginning it is taking place from this deep inguinal ring and it is extending like this. Yes, and it is somewhat like this, right? So first I will talk about this ring, that is the deep inguinal ring. जहां से beginning start हो रही है, जहां से beginning मतलब where it is beginning from. So yeah, it is the deep inguinal ring. Okay, now deep inguinal ring. Now deep inguinal ring, beta, it is an oval opening. Now what is the shape of this opening? It is oval opening in the fascia transversalis. Okay, fascia transversalis. बेटा हम लोगों ने लेयर्स पढ़ी थी एब्डोमिनल वॉल की, एंटीरियर एब्डोमिनल वॉल की। आप लोगों को पता है स्किन, इट इज द आउटर मोस्ट लेयर, फिर सुपरफिशियल फेशिया आता है, फिर मैंने बताया था डीप फेशिया एब्सेंट होता है, फिर वी हैव द मसल लेयर, एक्सटर्नल ऑब्लिक मसल, इंटरनल ऑब्लिक मसल, ट्रांसवर्स एब्डोमिनस मसल, फिर आता है ट्रांसवर्सैलिस फेशिया। फेशिया इज अ मेम्ब्रेन, ठीक है, फेशिया एक मेम्ब्रेन है, ठीक है, और इसी मेम्ब्रेन में अगर ओपनिंग देखने को मिलेगी तो इस ओपनिंग को, that opening it is called as the deep inguinal ring. Okay, that opening it is called as the deep inguinal ring. स्किन बाहर से अंदर की तरफ जा रहे हैं ना, सुपरफिशियल फेशिया, एक्सटर्नल ऑब्लिक, इंटरनल ऑब्लिक, ट्रांसवर्स एब्डोमिनस और ट्रांसवर्सैलिस फेशिया, और फेशिया ट्रांसवर्सैलिस। इतना क्लियर है? इतना क्लियर हो गया सब लोगों को? ठीक है। Now this is something which is lying 1.25 centimeters 1.25 centimeters above which ligament? Yes, above the inguinal ligament. So ये ring की ही, yeah, above the inguinal ligament, right? This is like which is lying 1.25 centimeters above the inguinal ligament, right? Now I hope this is clear बेटा, I hope this is clear. Deep inguinal ring समझ में आया? अगर हम इसके एंड की बात करें, एंड पे थोड़ा सा डिस्कशन ले लेते हैं, right? And okay, Aditya, very good beta. Now if we talk about the end, you already know it ends at the superficial inguinal ring. Superficial inguinal ring. Now what is superficial inguinal ring beta? Superficial inguinal ring, it is an opening, or I can simply say it is, okay, firstly you should know what is the shape of this opening. Shape क्या है, मैंने अभी आप लोग को बताया, it is triangular in shape. Okay, it is triangular in shape, right? It is a triangular in shape. Now yes, now it is an opening beta in the external oblique aponeurosis. It is an opening in the external oblique aponeurosis. It is a triangular opening in the external oblique aponeurosis. तो आप लोगों को मैंने बताया था कि देखो स्टार्टिंग करो, स्किन हो गया, सुपरफिशियल फेशिया, एक्सटर्नल ऑब्लिक मसल, इसी एक्सटर्नल ऑब्लिक मसल की एपोन्यूरोसिस होगी, उसका नाम क्या होगा? एक्सटर्नल ऑब्लिक एपोन्यूरोसिस, राइट? सो रिमेंबर गाइस दैट दिस इज समथिंग व्हिच विल हैव दिस ओपनिंग, ओके? इसी एपोन्यूरोसिस में एक ट्रायंगुलर शेप्ड ओपनिंग होती है, एंड दैट इज समथिंग व्हिच इज कॉल्ड एज द सुपरफिशियल इंग्वाइनल रिंग। और देख रहे हो ये ज्वाइन कर रहा है रिंग, इस तरीके से ये रिंग है। इफ यू कैन जस्ट सी दिस पिक्चर गाइस, राइट? आई होप ये थोड़ा सा माइंड मैपिंग हो रहा है कि ये, अब ऑब्वियसली बात है बेटा, अब मैंने बोला ना डीप इंग्वाइनल रिंग, तो ये पीछे से आ रहा है, ट्रांसवर्सैलिस फेशिया बिल्कुल अंदर वाली वॉल है, एब्डोमिनल वॉल है, और बाहर की तरफ क्या है? स्किन है, सुपरफिशियल फेशिया, एक्सटर्नल ऑब्लिक है, तो इट इज कमिंग फ्रॉम बिहाइंड टू फ्रंट, राइट? ऑब्वियसली, सो डीप से बाहर आ रहा है सुपरफिशियल की तरफ, राइट? So it is superficial inguinal ring. So it is the shape, it is an opening in the external oblique aponeurosis, right? Now you should know that superficial inguinal ring, the base it is formed by the lateral half of pubic crest. अब मुझे बताने की जरूरत नहीं है प्यूबिक क्या है, प्यूबिक बोन है, और क्रेस्ट क्या होता है? इट इज द थिकेंड बॉर्डर, pubic crest, okay? The base, I'm just talking about this base. So the base will be formed by the lateral half of the pubic crest, okay? Now if we talk about the apex, देखो ट्राइंगल है ना, ट्राइंगल का क्या होगा? एक एपेक्स होगा, नीचे क्या होगा, बेस, और दो क्या होंगी, साइड्स होंगी, देयर विल बी टू साइड्स, राइट, देयर विल बी टू साइड्स. So the base, it is formed by the lateral half of the pubic crest, and if we talk about the apex, so beta apex, it is directed upwards and lateral. ये ध्यान रखना, apex जो है थोड़ा lateral side पे होता है, apex is towards the lateral side. I will show you in the picture also, no need to worry. And the two sides of this triangle, they are called as the medial crus and the lateral crus. The medial crus and the lateral crus. Okay, so the medial crus, it is attached. Okay, it is attached below to the pubic symphysis. It is attached below to pubic symphysis, and the lateral crus, beta, the lateral crus, it is attached below to the pubic tubercle. Attached below to pubic tubercle. तो ऑब्वियसली बात पता है ना बेटा कि प्यूबिक सिम्फाइसिस तो ये वाला जॉइंट हो गया. ओके, प्यूबिक सिम्फाइसिस तो ये वाली चीज हो गई, प्यूबिक सिम्फाइसिस. और हमें पता है कि इसमें ही अगर एक राउंड ओपनिंग हो जाए तो उसको हम लोग क्या बोलते हैं, प्यूबिक ट्यूबरकल. प्यूबिक ट्यूबरकल. तो प्यूबिक सिम्फाइसिस तो बेटा मीडियल साइड पे है ना. तो एक जो स्लिट है, इट इज टुवर्ड्स द प्यूबिक सिम्फाइसिस, और एक जो स्लिट है, इट इज टुवर्ड्स द प्यूबिक ट्यूबरकल. इट इज टुवर्ड्स द प्यूबिक ट्यूबरकल. आई होप दिस इज क्लियर टू एवरीवन. बेटा जल्दी से एक थम्स अप दे दो चैट बॉक्स में कि ये समझ में आ गया. तो फटाफट से एक बार पिक्चर में भी देख लेते हैं. मैंने इसके डीप इंग्वाइनल रिंग और सुपरफिशियल इंग्वाइनल रिंग के बारे में बताया है. आई हैव जस्ट टॉक्ड अबाउट लाइक द साइट. ओके, I've talked about how they are formed, right? Aditya, Angel, Dimple, Garima, very good बेटा. बाकी सब जिंदा है तो रिप्लाई कर दिया करो. Yes, अनुष्का, very good, very good. These are certain important topics that you have to actually understand बेटा. अब बेटा इस पिक्चर को ना बहुत ध्यान से देखना है, बहुत ध्यान से देखना है. मैंने आप लोगों को बताया, देखो यहां से देखो बेटा, ये जो मैं हाईलाइट कर रहा हूं, ओके, पहले चलो मैं लेबल कर देता हूँ, लेबल कर देता हूँ, क्योंकि ये पिक्चर्स क्लियर नहीं होंगी जब तक. यस, देखो पीछे से स्टार्ट करो बेटा. ये जो लेयर है, दिस वन विच आई हैव जस्ट मार्क्ड विद एरो, तो ये है ट्रांसवर्सालिस फेशिया. ट्रांसवर्सालिस फेशिया. अब ट्रांसवर्सालिस फेशिया के बाद क्या आएगा, ट्रांसवर्स एब्डोमिनस मसल, फिर आएगा इंटरनल ऑब्लिक मसल, और फिर आ जाता है एक्सटर्नल. देखो ये एक्सटर्नल ऑब्लिक मसल है, तो इसी एक्सटर्नल ऑब्लिक मसल की जो एपोन्यूरोसिस है, तो उसको हम लोग नाम क्या देंगे, एक्सटर्नल ऑब्लिक एपोन्यूरोसिस, जो व्हाइट वाले उसमें है, जो व्हाइट वाले उसमें. तो अब ये देखो ट्रांसवर्सालिस फेशिया, ये यहां से यहां तक जा रहा है, ये दिख रही ओपनिंग, दिख रही है आप लोगों को, कैन यू सी दिस ओपनिंग बेटा. इसी को हम लोग कहते हैं डीप इंग्वाइनल रिंग. और ये किसमें ओपनिंग है, ट्रांसवर्सालिस फेशिया में, ओनली ट्रांसवर्सालिस फेशिया. इसी के अंदर एक ओपनिंग दिखाई दे रही है. यस, इसी के अंदर एक ओपनिंग दिखाई दे रही है, विच यू कैन वेरी वेल सी ओवर हियर, राइट. तो दिस इज समथिंग विच यू कैन लाइक सी. ये सिर्फ ट्रांसवर्सालिस फेशिया में, इसको बोलते हैं डीप इंग्वाइनल रिंग. दिस इज कॉल्ड एज द डीप इंग्वाइनल रिंग. नाउ कमिंग ऑन टू दिस पर्टिकुलर पार्ट बेटा, सुपरफिशियल इंग्वाइनल रिंग. तो सुपरफिशियल इंग्वाइनल रिंग देख सकते हो तुम लोग, देख रहे हो, ये एक्सटर्नल ऑब्लिक एपोन्यूरोसिस में ओपनिंग है. इट इज एन ओपनिंग इन द एक्सटर्नल ऑब्लिक एपोन्यूरोसिस, और बिल्कुल एक ट्रायंगुलर शेप की तरह है, जिसका एपेक्स जो है बेटा वो लेटरल साइड की तरफ है. एपेक्स जो है वो लेटरल साइड की तरफ है, ठीक है. ये वाली बाउंड्री लेटरल बाउंड्री हो जाएगी, ये वाली कौन सी हो जाएगी, मीडियल बाउंड्री. और नीचे क्या आ जाएगा, और नीचे अगर तुम ध्यान से देखोगे तो आपको लिगामेंट देखने को मिल रहा है, ठीक है. यस, इंग्वाइनल लिगामेंट अलोंग विद द लैक्यूनर लिगामेंट आल्सो. क्या ये चीज क्लियर है. तो ये पूरी की पूरी रिंग दिख रही है आपको कैसे अंदर से बाहर आ रही है. ओके, इट इज कमिंग फ्रॉम द डीप लेयर्स टू द सुपरफिशियल लेयर्स. सो यस, फटाफट से बता दो, एक थम्स अप दे दो कि ये समझ में आई पिक्चर हमें, सिर्फ बाउंड्री बाउंड्री की बात की जाए। अगर लेयर्स याद है तो बहुत इजी है, ठीक है। स्किन, सुपरफिशियल फेशिया, एक्सटर्नल ऑब्लिक मसल, इंटरनल ऑब्लिक ट्रांसवर्स एब्डोमिनस, ट्रांसवर्सालिस फेशिया, राइट। तो हाँ, गरिमा, डिंपल, एंजल, कृति, वेरी गुड। कपिल, वेरी गुड बेटा, चलो वेरी गुड। अब इतना क्लियर हो गया, तो फटाफट से अब हम लोग इसकी बाउंड्रीज देख लेते हैं। फटाफट से अब हम लोग इसको देखेंगे, अब इसकी देखेंगे बाउंड्रीज। चलो, बाउंड्रीज के लिए बेटा एक पिक्चर बनानी बहुत जरूरी है। ओके, बाउंड्रीज के लिए पिक्चर बनानी बहुत जरूरी है। कभी कभार ना बेटा साइट में ना अगर मैंने 4 सेंटीमीटर लिखवाया है, तो कभी कभार पेपर में 3.8 भी दिया हुआ है ऑप्शन में, तो मेक श्योर यू राइट दिस ऑल्सो, राइट। मतलब किसी पेपर में 3.8 था, किसी में 4 भी दे देते हैं, तो इट्स लाइक डिपेंड्स, राइट। सो यस विकी, दिव्यश्री, वेरी गुड, वेरी गुड। चलो अब बाउंड्रीज की बात करते हैं। नाउ कमिंग ऑन टू द बाउंड्रीज ऑफ दिस कैनाल। अब बहुत ध्यान से तुम ही लोग बताओगे मुझे कि बाउंड्रीज के लिए पहले चलो पिक्चर बना लेते हैं और फिर उसको उसमें भी देखेंगे, डायग्राम में भी। एटलेस के डायग्राम्स बहुत इंपॉर्टेंट है, दे शुड बी लाइक मेमोराइज्ड। और अब तो पता ही है कि एफएमजी एग्जाम देना ही है सबको, तो पढ़ना तो पड़ेगा ही एनाटॉमी, नो चॉइस लेफ्ट। हम्म, यस, हाँ। नाउ बेटा लेट अस सपोज दैट दिस इज, नाउ दिस इज द ट्रांसवर्सालिस फेशिया। मैंने बोला ट्रांसवर्सालिस फेशिया में देयर इज एन ओपनिंग, ओके। नाउ आई एम टेकिंग अ क्रॉस सेक्शन बेटा, मैं अभी ट्रांसफर सेक्शन ले रहा हूँ, आई एम जस्ट टेकिंग अ ट्रांसफर सेक्शन of this canal. I'm just trying to show how it will look like, right? How it will look like. And yeah, this is an opening guys, and this is nothing but the, yeah, transversalis fascia. And this is the opening beta, and this opening it is called as the deep inguinal ring, right? This is the deep inguinal ring, right? अभी हमने देखा था इसी फेशिया में अगर एक छेद हो जाए कौन सा, that is the deep inguinal ring. Now we already know we have one muscle over here that is towards, okay, that is forming an aponeurosis, that is the external oblique aponeurosis. And these aponeurosis, external oblique aponeurosis, on the medial side it will give, yeah, it will give an opening, and this is called as the superficial inguinal ring. So this is called as superficial inguinal ring. ये हमने क्रॉस सेक्शन लिया बेटा, सिर्फ देखने के लिए हमने क्रॉस सेक्शन लिया है, राइट। नाउ बेटा यू ऑलरेडी नो व्हिच मसल लेयर इज दिस, दिस इज द एक्सटर्नल ऑब्लिक एपोन्यूरोसिस। और ये किससे बना हुआ है, एक्सटर्नल ऑब्लिक मसल कंटिन्यूज टू फॉर्म द एक्सटर्नल ऑब्लिक एपोन्यूरोसिस, राइट। इंसर्शन होता है एक्सटर्नल ऑब्लिक मसल का, राइट। नाउ you already know this canal, it is directed medially downwards and somewhat like this, somewhat like this, right? Now, in between beta, just to understand the boundaries, just to understand the boundaries, we have two more muscle layers, guys. We have two more muscle layers, and I will try to draw it for you people. And these two muscle layers, you already know that we have. Can you name these two muscle layers, beta? Which two muscle layers will be in between? In the chat box, guys. In the chat box, everyone. Which two muscle layers will be in between? Yes, very good fun mode. It is transverse abdominis and internal oblique muscle. It is transverse abdominis and internal oblique muscle. तो चलो ये तो क्लियर हो गया तुम लोगों को, ये तो we have the transverse abdominis and the internal oblique muscle. Very good, beta. So this is, yeah, it is the internal oblique muscle, and we have the transverse abdominis muscle, and above it we have transversalis fascia. Already I have mentioned. तो बेटा डायरेक्शन जो है इसका, डायरेक्शन आपको पता होना चाहिए. दिस क्रॉस सेक्शन इज इन, ये एंटीरियर आगे की तरफ, पोस्टीरियर पीछे की तरफ. We have the medial and the lateral. So direction is like this. Direction is like this, right? Now, so remember, guys. Remember that the anterior boundary. Okay. Now coming on to the anterior part. So you are very well aware कि जो anterior part है, if I just try to take a small portion from here, okay. Now, so can anyone tell me the anterior boundary? It will be formed by which two muscles? Yeah, the anterior boundary or the anterior wall, it will be formed by, it is formed by, beta, remember it is the, yeah, yes, very good, beta. It is the internal oblique muscle and the external oblique aponeurosis. Okay, so yes, we have the internal, this is the anterior wall, right? So we have the internal oblique muscle plus external oblique aponeurosis. External oblique aponeurosis, right? Now, coming on to the posterior part, beta. Coming on to the posterior part, you should remember that, now you should remember, beta, transverse abdominis and internal oblique muscle, they both together join. They actually run above the inguinal canal. They will go above the inguinal canal and they both will join to form a tendon, and that is something which is referred to as the conjoint tendon. This is something which is referred to as the conjoint tendon. They will just run above this canal and this is called as the conjoint tendon, right? This is the conjoint tendon. Okay, and the posterior wall, beta, the posterior wall, it will be formed by this part, transversalis fascia and the conjoint tendon. Okay, so remember the posterior wall, it is formed by fascia transversalis plus conjoint tendon. Conjoint tendon, क्या बताओ मुझे फटाफट से, ये क्लियर हो क्या कि एंटीरियर वॉल किसका बना हुआ है और पोस्टीरियर वॉल किसका बना हुआ है? जल्दी से बताओ, फटाफट से एक थम्स अप दे दो जल्दी से अगर क्लियर हो गया है तो. इसको फैक्स इंग्वाइनालिस भी बोलते हैं. इट्स आल्सो कॉल्ड एज फैक्स इंग्वाइनालिस, कंजॉइंट टेंडन को. यस डिंपल टी, वेरी गुड. इट इज आल्सो कॉल्ड एज फैक्स इंग्वाइनालिस, राइट? बेटा अगर वैसे इलाबोरेटली देखोगे तो ट्रांसवर्सालिस फेशिया ही होगा। इंटायर एक्सटेंट जो पोस्टीरियर वॉल बना रहा है दैट इज ट्रांसवर्सालिस फेशिया। कंजॉइंट टेंडन इट इज फॉर्मिंग द posterior wall towards which side? Okay, tell me if you have understood beta. Tell me that conjoint tendon it is forming the posterior wall towards which side? तो अगर हम लोग ये क्वेश्चन पूछते हैं बेटा, ये तो मीडियल साइड हो गई और ये हो गई लेटरल साइड, तो ट्रांसवर्सालिस फेशिया तो पूरा का पूरा पोस्टीरियर वॉल बना रहा है थ्रू आउट, मीडियल हो लेटरल हो। यस वेरी गुड फन मोड अनुष्का, एग्जाम्पल कपिल, पीयूष वेरी गुड, गरिमा वेरी गुड। और अगर मैं पूछूं कि इंटरनल ऑब्लिक मसल इज फॉर्मिंग द एंटीरियर वॉल टुवर्ड्स विच साइड? या एवरीवन इज राइट, इंटरनल ऑब्लिक मसल इट इज फॉर्मिंग द एंटीरियर वॉल टुवर्ड्स विच साइड? इंटायर एंटीरियर वॉल पे तो एक्सटर्नल ऑब्लिक एपोन्यूरोसिस होगी, ठीक है, इंटायर एब्डोमिनल वो इंग्वाइनल कैनाल के इंटीरियर वॉल इट इज कंप्लीटली एक्सटर्नल ऑब्लिक एपोन्यूरोसिस थ्रू आउट, या लेटरल साइड पे होगी। वेरी गुड बेटा। सो दिस क्लैरिटी आई वांटेड इन योर माइंड। चलो ये भी ठीक है, ये भी ठीक है। तो ओके, अब मेरा क्वेश्चन ये है तुम लोगों से, अब मुझे तुम ये बताओगे कि सुपीरियर बाउंड्री, इसी पिक्चर को देखकर बताओ, द सुपीरियर बाउंड्री इट इज फॉर्म्ड फ्रॉम व्हाट? तो थर्ड अगर मैं लिखूं द सुपीरियर बाउंड्री, सुपीरियर मींस इसके ऊपर से क्या जा रहा है बेटा? सुपीरियर बाउंड्री और सुपीरियर वॉल इट इज फॉर्म्ड फ्रॉम व्हाट? टेल मी इन द चैट बॉक्स। द सुपीरियर वॉल इट इज फॉर्म्ड फ्रॉम, ऊपर से क्या पास कर रहा है बेटा? हाँ, वेरी गुड, बोलो। देखो बेटा ऊपर से क्या पास कर रहा है, यू गाइस आर लिसनिंग और नॉट, आई डोंट नो, कमेंट्स ही बंद हो जाते हैं बिल्कुल, आंसर देते रहा करो। ऊपर से अभी तो तुम लोगों को बताया है। हाँ अनुष्का वेरी गुड, ट्रांसवर्स एब्डोमिनस, या वेरी गुड, इंटरनल ऑब्लिक प्लस ट्रांसवर्स एब्डोमिनस मसल, इंटरनल ऑब्लिक प्लस ट्रांसवर्स एब्डोमिनस मसल, ट्रांसवर्स एब्डोमिनस मसल। और फोर्थ पॉइंट लिख लो, फ्लोर बता दो किसका बना होगा। सब ठीक है, डिंपल दी यस, फ्लोर बता दो किसका बना होगा। नीचे क्या प्रेजेंट है इंग्वाइनल लिगामेंट के, सॉरी इंग्वाइनल कैनाल के, आई ऑलरेडी टोल्ड द आंसर, इट इज द इंग्वाइनल लिगामेंट, इट इज द इंग्वाइनल लिगामेंट प्लस बेटा, ओके, plus you will get lacunar ligament also, and this lacunar ligament I have already told you yesterday, okay, lacunar ligament वो triangular shape ligament था ना बेटा, जो inguinal ligament को pectineal ligament से connect करता था। yes, I have already told you about this inguinal ligament and lacunar ligament yesterday only. So if you just see this picture I have drawn, so can you see this blue wala part, blue wala part in this picture? So that is the lacunar ligament, that is the lacunar ligament. So it is also forming this, yes it is also forming this particular part. Very good beta. So you can easily see in this picture also, in this picture also, if you just want to highlight this, I'll just use the yellow color. Yes, this is the lacunar ligament, it's forming the, yeah, the floor of this inguinal canal, right? It is forming the floor of this inguinal canal. Now guys, I have a question in this picture, I have a question in this picture. Can anybody identify this particular muscle? Can anyone identify this particular muscle? देखो मैं भी देखूं कितना तुम लोग का दिमाग तेज है। आपको पता है ये मीडियल साइड है और ये लेटरल साइड है, तो अब मुझे बता दो मीडियल साइड पे कौन सी मसल है जो काट के दिखाई हुई है। चलो I want the answer everyone, just try to tell me which muscle is this जो मिड लाइन में प्रेजेंट है। वेरी गुड अनुष्का, वेरी गुड बेटा, इट इज रेक्टस एब्डोमिनस। बेटा मिड लाइन में तो रेक्टस एब्डोमिनस होगी ना, इसका यहां से तो कोई लेना देना नहीं है। हाँ रेक्टस एब्डोमिनस है गरिमा, वेरी गुड वेरी गुड। ट्रांसवर्स बेटा कैसे हो सकती है? ट्रांसवर्स देखो बेटा, ट्रांसवर्स एब्डोमिनस को ट्रेस कर बेटा यहाँ से, ये देख, ये देख, ट्रांसवर्स एब्डोमिनस इज गोइंग लाइक दिस। इसका तो फेशिया आ गया ना इसके आगे। मैंने तो ये कल भी बताया था, रेक्टस शीथ में इन्वॉल्व होता है ये रेक्टस शीथ में इन्वॉल्व होता है, याद है? तो ट्रांसवर्स एब्डोमिनस का तो ये फेशिया आ गया। यस, क्लियर हो गया बेटा, ये कंसेप्ट क्लियर है? चलो फटाफट से एक थम्स अप दे दो कि हमें इंग्वाइनल कैनाल की डेफिनेशन क्लियर हो गई। लेंथ तो ठीक है, साइड, डायरेक्शन, बाउंड्रीज, बिगनिंग मतलब जो डीप इंग्वाइनल रिंग, सुपरफिशियल इंग्वाइनल रिंग और उसकी जितनी बाउंड्रीज थी वो सब क्लियर हो गया है। चलो वेरी गुड, अब ये सब क्लियर हो गया है तो कंटेंट्स लिख लेते हैं। चलिए अब कंटेंट्स लिख लेते हैं। चलिए एक चीज और लिख लेना है यहाँ पे, एक तो सेक्स डिफरेंस आप लोग को पता होना चाहिए कि मेल और फीमेल में व्हाट इज द डिफरेंस बिटवीन द इंग्वाइनल कैनाल, व्हाट इज द डिफरेंस बिटवीन द इंग्वाइनल कैनाल बेटा? सो या द इंग्वाइनल कैनाल, the inguinal canal is wider in males than females. Okay, the inguinal canal is wider in males than females, right? Now, structures passing through the canal, very, very important, or contents of the inguinal canal. Contents of the inguinal canal, or I can simply say, yeah, the structures passing. Now when I say structures passing, इस पाइप के अंदर से क्या पास करेगा, right? इस कैनाल के अंदर से what are the structures that will pass from this particular pipe? So yes, structures passing through the canal. Now बेटा, अब इसमें ना there is a difference in males and females, right? That's why I've written the sex difference. In males, what are the structures that will pass? And in females, what are the structures that will pass? Now in males, beta, remember, we have the spermatic cord, okay, plus ilioinguinal nerve. Ilioinguinal nerve. I will discuss this nerve in detail when I'll discuss the lower limb. Okay, ilioinguinal nerve. When we talk about in the females, beta, it is the round ligament. It is just a remnant, beta, that you have to remember. Round ligament, okay, of uterus. And again, there is the same nerve, that is the ilioinguinal nerve. Ilioinguinal nerve, right? So yes, that is about the structures that are, yeah, Vicky Chaudhary, very good beta, very good. Yes. Now beta, one more thing that I wanted to mention you, that for example, this is the inguinal canal. Okay, this is the inguinal canal, right? Okay, I'll just, I'm drawing like, I'll try to draw it oblique only so that you have a clear picture that it is oblique in nature. So yes, so this canal is somewhat like this, right? This canal is somewhat like this oval opening, and this is the deep inguinal ring. Deep inguinal ring. This is the superficial inguinal ring. Now we have the, देखो ये वाला साइड क्या हो जाएगा, एंटीरियर, ठीक है, ये वाला साइड एंटीरियर, पीछे वाला साइड क्या हो जाएगा, पोस्टीरियर, पोस्टीरियर, राइट? So remember, if we talk about the spermatic cord, okay, if we talk about the spermatic cord, beta, spermatic cord, it is coming from the deep inguinal ring and it is passing through the superficial inguinal ring. Okay, spermatic cord, it is coming from the deep inguinal ring and it is passing from the superficial inguinal ring. So it is the spermatic cord, right? But if we talk about the ilioinguinal nerve, Okay, the ilioinguinal nerve. This ilioinguinal nerve is not passing throughout, beta. It is not passing throughout. Okay, it is only, it pierces the posterior wall. Okay, it pierces the posterior wall and then it enters into the this contents of the inguinal canal. So yeah, it's a pseudo content, or you can just say, because it is not present throughout, it pierces the posterior wall and then it comes. So this is the ilioinguinal nerve. Ilioinguinal nerve. Ilioinguinal nerve. Remember, it pierces the posterior wall of the canal. छेद करना, pierce का मतलब क्या होता है? छेद करना, पीछे वाली वॉल से छेद करके आता है. Pierces the posterior wall of the canal. Okay, then passes out through the superficial inguinal ring. Through the superficial inguinal ring. इतना क्लियर है? कंटेंट्स क्लियर हो गए? स्पर्मेटिक कॉर्ड को थोड़ा सा डिटेल में पढ़ना पड़ेगा. ओके, स्पर्मेटिक कॉर्ड को थोड़ा सा डिटेल में पढ़ना पड़ेगा. फटाफट से एक थम्स अप दे दो. उससे पहले जल्दी से एक फटाफट से थम्स अप दे दो कि हाँ सर ये क्लियर हो गया. कंटेंट्स क्लियर हो गए, बाउंड्रीज क्लियर हो गए, हमारा डीप इंग्वाइनल रिंग, सुपरफिशियल इंग्वाइनल रिंग, ये सब क्लियर है. लेंथ, साइड, डायरेक्शन, एवरीथिंग इज क्लियर. सो दिस टॉपिक इंग्वाइनल कैनाल इज ओवर. नाउ आई विल स्टार्ट विद द स्पर्मेटिक कॉर्ड. स्पर्मेटिक कॉर्ड, क्योंकि हर्निया समझने के लिए, टू अंडरस्टैंड द हर्निया, स्ट्रक्चर ऑफ द स्पर्मेटिक कॉर्ड इज वेरी वेरी इंपॉर्टेंट बेटा. Structure of the spermatic cord is very very important. आपको पता है spermatic cord testis. Okay, so yes, this spermatic cord, it is coming. So you can very well see this is the spermatic cord. ठीक है, और वो spermatic cord ये देखो superficial inguinal ring से बाहर आ रहा है. ठीक है, और it is attached to the testis over here. Right, it is attached to the testis. Yes, very good. Clear fun mode. ठीक है बेटा. ठीक है, बाकी भी रिप्लाई करते रहा करो. तो स्पर्मेटिक कॉर्ड इज अगेन अ वेरी इंपॉर्टेंट टॉपिक, और अलग से भी डिस्कस कर सकते थे, बट पहले इसको एक्चुअली हर्निया समझने के लिए ना बहुत जरूरी होता है. सो या, स्पर्मेटिक कॉर्ड, फर्स्टली यू शुड नो द डेफिनेशन. व्हाट इज द स्पर्मेटिक कॉर्ड? सो यस, definition. Now remember beta that it is a group of structures. It is a group of structures. Okay, now when I say group of structures, basically you should know it is vast difference. Okay, vasectomy में which structure is ligated? चलो ये भी बता दो. We have vessels. Okay, vessels, when I say arteries and veins are there, right? We have the nerves. We have lymphatics in this particular structure, right? That are dragged by the testis as it descends into the scrotum. As it descends into the scrotum, right? So obviously you know, so this is a cord like structure that is passing through the ring. And again, this cord is composed of vast difference. We have arteries, veins, nerves, lymph nodes. Okay, and it is tapped by the testis. Okay, and it is, you know, it will descend into the scrotum. Now, what is the site of the spermatic cord? So remember the site. See, it extends. Now, extension मैंने बताया था. It extends from the deep. Yes, Garima, very good. It is the vast difference only. Deep inguinal ring. Deep inguinal ring से आ रहा है. मैंने पहले भी बताया था. Deep inguinal ring और ये superficial inguinal ring है. So this spermatic cord is coming from the deep inguinal ring. So yeah, it is coming through the deep inguinal ring to the lower end of the testis. To the lower end of testis. Okay, lying partly in the inguinal canal, and partly in the scrotum, and partly in the scrotum. So it extends from the deep inguinal ring to the lower end of the testis. Obviously, आधा part अंदर है, superficial inguinal ring के बाहर भी part आ रहा है, okay, and that is into the scrotum, right? That is into the scrotum. तो ये सब चीजें क्लियर हो गई, ये सब बहुत बेसिक सी चीजें थी. Now, what we have to discuss, the third topic that we have to discuss over here, it is the coverings of the spermatic cord, and that is something very, very important. Coverings of the spermatic cord. जैसे पाइप में से in a pipe the water flows, right? Simply. So in that inguinal canal, the spermatic cord is there, right? So that is the content. Okay, that is the content. Now, covering of the spermatic cord beta. Covering of the spermatic cord. The spermatic cord beta has three layers, I would say. It has three layers. The very first one, okay, it has three coverings from outside to inside, okay. From outside to inside, it has three coverings. The first one, it is called as the external spermatic fascia. External spermatic fascia. Then second one beta. The second one beta. It is the cremastric muscle, cremastric muscle and fascia. Cremastric muscle and fascia. And the third one beta. The third one from the outer to the inner part, it is the internal spermatic fascia. It is the internal spermatic fascia. Now I will draw a diagram for you also. No need to worry. I'll just show you the cross section. What are actually the contents over here? Yes. Now, beta. Now you already know the external spermatic fascia. Beta, remember the external spermatic fascia. It is continuation of, or you can say it is continuation of external oblique aponeurosis. External oblique aponeurosis. External oblique aponeurosis beta, it descends downwards also, okay, and it is given a new name in this spermatic cord, and that is called as the external spermatic fascia. External spermatic fascia kuch nahi hai, it is the continuation of the external oblique aponeurosis only. It is the continuation of the external oblique aponeurosis only. तो बिल्कुल भी कंफ्यूज नहीं हो रहा है, बस नए नाम दे दिए, ठीक है. अब थोड़ा सा दिमाग लगाओ, एक्सटर्नल ऑब्लिक एपोन्यूरोसिस ये हो गया. Cremastric muscle and fascia will be which muscle, right? Which it will be continuation of which muscle beta? Internal oblique and transverse abdominis muscle. Okay, transverse abdominis muscle, right? It is continuation of, yes, 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 yes. Or internal spermatic fascia beta. Internal spermatic fascia. It will be continuation of which fascia beta? It is continuation of fascia transversalis. It is continuation of fascia transversalis. Right? It is continuation of fascia transversalis. Very good. Everyone is right. I hope this is clear. क्योंकि हमें पता है बाहर से layers हमें अच्छे से याद है. It is the skin, superficial fascia, deep fascia is absent. Then we have the external oblique muscle, internal oblique muscle, transverse abdominis muscle, and the transversalis fascia. So external oblique muscle की aponeurosis, external oblique aponeurosis, which is continuing as external spermatic fascia in the spermatic cord. Internal oblique muscle and transverse abdominis muscle will continue as the cremastric muscle and the fascia. And the fascia transversalis will continue as the internal spermatic fascia. क्या इतना क्लियर है सब लोगों को? क्या इतना क्लियर है? जल्दी से फटाफट से एक थम्स अप दे दो चैट बॉक्स में. जल्दी फटाफट से एक थम्स अप दे दो चैट बॉक्स में. या गरिमा says yes sir. Yes. Perfect. Angel, perfect. Dimple, perfect. Perfect beta. वन मोड, परफेक्ट परफेक्ट बेटा। चलिए चलिए। चलो अब इसका ना क्रॉस सेक्शन देख लेते हैं। तो व्हाट आई एम ट्राइंग टू डू, आई एम जस्ट गोइंग टू टेक अ क्रॉस सेक्शन नाउ। टीएस ले लिया मैंने, ट्रांसफर सेक्शन ले लो, और उसको फिर मैं बना के देखते हैं। तो let us now, yeah, just try to draw it. So you already know the outermost structure, okay? अब इसका ट्रांसफर सेक्शन ले लिया है, तो you should be aware, yeah, this will be the external spermatic fascia, right? Then I will draw with another color so that you guys don't confuse. So we have the pre-mastoid muscle and fascia. Let me draw this with red color so that the color coding is, yes. So yes, we have the, कुछ नहीं, इन्हीं layers को I'm just trying to draw it. Hmm. And the third layer, beta, you are already aware that we have the internal spermatic fascia. Yeah, we have this internal spermatic fascia. So I'll just label this for you people. Yeah, I'll label this. Yes, yes, everyone is right. Everyone is right. Nothing to worry about, because yes, this is the external spermatic fascia. Pre-mastoid fascia. We are taking a transverse section, beta. Pre-mastoid fascia, or the muscle and the fascia. And the third one, beta, it is the internal spermatic fascia, right? It is the internal spermatic fascia. It's the internal spermatic fascia, right? Now, now what you will get inside it? What you will get inside it, beta? So अब इसके अंदर आपको क्या देखने को मिल रहा है? ये वेन्स दिख रही हैं आप लोगों को, वेन्स दिख रही हैं। तो yes, you can see the veins over here. Yes, we have one very famous artery, and that is called as the testicular artery, beta. Okay, this is called as the testicular artery, which you can see over here also. So we have this testicular artery, which is supplying the testis, right? We have the testicular artery. So yes, this is the testicular artery, which you can see. Now this testicular artery, it is surrounded by veins. Can you see these veins? These are in the form of plexus yeah. Yes, you're right. Testicular artery plus nerve, सही है बिल्कुल बेटा. Ampiniform plexus of veins, हाँ बिल्कुल ठीक है. तो this is surrounded by, yeah, I'll just use the dark one. Yeah, it is surrounded by veins, and this is called as the Pemponiform plexus of veins. So this is called as, yeah. कुछ लिख रहा है क्या? या पैम्पिनीफॉर्म. देखो पैम्पिनीफॉर्म का मतलब होता है छलनी जैसा, जो जिससे चाय नहीं छानते हैं, मतलब the one which we used to know. Yeah, पैम्पिनीफॉर्म plexus of veins. वेन्स का नेटवर्क देखने को मिलता है. यू कैन सी दिस नेटवर्क बेटा, ये नेटवर्क देखने को मिल रहा है. दैट इज द पैम्पिनीफॉर्म प्लक्सस ऑफ वेन्स, राइट? दीस आर द पैम्पिनीफॉर्म प्लक्सस ऑफ veins, right. Yes, now we have something which is called as the vas deferens over here, right? There is something which is called as the vas deferens. And this vas deferens, it is also called as the ductus deferens. इसको ductus deferens भी बोलते हैं, or it is also called as the vas deferens, right? It is also called as the vas deferens. And we have an artery that is supplying to this, and that artery Yeah, it is called as the artery to the ductus deferens. Okay, this is called as the artery to vas deferens or ductus deferens, right? So yes, apart from that, beta, apart from that, you will encounter one nerve over here. You will get a nerve over here. Yes, and that nerve, it is called as the, it is genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve. Okay, that is also called as the cremastric nerve. It is also called as the cremastric nerve. Okay, genital branch of the genitofemoral nerve. Okay, so we have, hmm, yeah, we have the cremastric vessels also. If you want, we can like draw that also. So yes, it is situated over here, okay, between the internal and the cremastric muscle. So yes, so you should know we have the cremastric vessels. Now, when I say vessels, beta, arteries and nerves. When I say vessels, it is arteries and nerves, right? So yes, so these two are the cremastric vessels, right? Hmm. Apart from that, beta, you will also encounter remnants of processus vaginalis. If I just want to draw this, we have remnant or remnant of processus vaginalis. We will discuss this later on when I'll discuss the lower part, right? Tunica vaginalis. जब हम वो चीजें discuss करेंगे, then I'll come in detail with that. I hope this is clear, everyone. Just give me a thumbs up, guys, that this diagram is clear as of now. The coverings of the spermatic cord is clear. Coverings of the spermatic cord is clear, and the contents are also clear. The contents are also clear. Yes. Angel Matthews, very good. Very good. Anushka, Dimple, साई कृष्णा गरिमा वेरी गुड बेटा कहोगे तो मैं लिखवा भी देता हूँ कहोगे तो मैं लिखवा भी देता हूँ लिखना है तुम लोगों को कंटेंट्स लिखवा दूं एक बार बोलो जल्दी से खुद लिख लोगे या लिखवाऊं फिर कहोगे नोट्स ज्यादा हो जाते रिवाइज करने के लिए अब एक डायग्राम में तुम लोग कर लो इतने लायक नहीं हो ना कि एक डायग्राम में कर लोगे तो फिर नो लिखवा देता हूँ कॉन्स्टिट्यूएंट्स ऑफ द स्पर्मेटिक कॉर्ड स्पर्मेटिक कॉर्ड चल सबसे पहली बात आपको पता होनी चाहिए वी हैव थ्री स्ट्रक्चर्स बेटा थ्री स्ट्रक्चर्स आर देयर राइट वी हैव द vas deferens also called as the ductus deferens. Now apart from that we have one more structure that is tympaniform plexus of veins. It is also network, so that's why I'm calling it as structure. Yes, it is tympaniform tympaniform plexus of veins. Apart from that, we have lymphatic vessels also that I have not drawn. Yeah, we have the lymphatic vessels. Now, apart from that, we have three arteries. Three arteries. Okay. Now, the very first one, it is testicular artery. Testicular artery. Now, you guys will tell me testicular artery is a branch of testicular artery is a branch of और इसका आंसर बिल्कुल आना चाहिए मेरे पास टेस्टिकुलर आर्टरी इज अ ब्रांच ऑफ और ये तो बिल्कुल डायरेक्ट ब्रांच है तो मुझे पता होना चाहिए अपार्ट फ्रॉम दैट Yes. Artery of vast difference. Yes. Artery of vast difference. Okay. Now it is coming from the inferior vesical artery. It is a branch of the inferior vesical artery. Yes, Kriti, very good beta, very good. Abdominal aorta, very good. Anushka, very good. मैंने बताया था abdominal aorta का direct branch abdominal aorta पढ़ाया था. Gonadal artery, gonads में testis और ovary आता है. Yes, Varun Kashyap, very good. Very good बेटा. Gonads में testis और ovary आता है. I've told you a number of times बेटा. Yes, और वास्ट डिफरेंस की जो आर्टरी आर्टरी टू वास्ट डिफरेंस बोलते हैं, just a branch of inferior vesical artery. Okay, no need to go in detail. I will like discuss when I'll discuss the pelvis part and everything. I'll come to that also. And we have cremasteric artery. Cremasteric artery, and we already know cremasteric artery is a branch from the inferior epigastric artery, right? It is a branch from the inferior epigastric artery. Now we have three nerves beta. We have three nerves. We have sympathetic nerve fibers. We have sympathetic nerve fibers. Sympathetic nerve fibers. We have cremasteric nerve. Cremasteric nerve. Okay, it is the genital branch of genitofemoral nerve. Of genitofemoral nerve. Right? And the third one, remember, it is the ilioinguinal nerve. That is again the constituent in both the cases, right? Ilioinguinal nerve. Ilioinguinal nerve. I hope this is clear to everyone. This is clear to everyone. So we have discussed the spermatic cord, the covering TS section, सब कुछ देख लिया हम लोगों ने, ठीक है? और अब okay. Now, yeah, I have to start something, and before coming or before starting with that particular part, okay, let us first discuss about the inguinal triangle beta. Inguinal triangle, also called as the Hasselbachs triangle. Inguinal triangle or Hasselbachs triangle. Then I will come to the mechanism of the inguinal canal. So before starting with the inguinal hernia beta, before starting with the inguinal hernia, let us just start with the inguinal or triangle, that is also called as the Hasselbachs triangle. Hasselbach's triangle. Okay. Now, firstly, beta, you should know that this triangle, okay, where is this triangle actually? It is a triangular area. This Hasselbach's triangle, it is a triangular area on the inner aspect, on the inner aspect of the lower part of the abdominal wall, of the lower part of abdominal wall. चलो पहले इसको बना के देखते हैं, फिर मैं तुम्हें समझाऊंगा. पहले इसको बना लेते हैं और फिर आई विल जस्ट ट्राई टू एक्सप्लेन यू गाइस, राइट? सो यू ऑलरेडी नो, इसकी बाउंड्रीज भी क्लियर हो जाएंगी बेटा, कि वी हैव दिस pubic symphysis, right? We have this pubic symphysis, right? We have this pubic bone. ये बेटा ये राइट साइड ले लेते हैं और ये लेफ्ट साइड ले लेते हैं. So you already know this is the pubic bone and this is the pubic symphysis. When the right pubic bone joins with the left pubic bone, तो ये pubic symphysis हो जाएगा, ठीक है ना बेटा? ये pubic symphysis, तो ये right वाला pubic bone हो गया, right pubic bone, और ये left pubic bone. तो दोनों pubic bone they will join in the front and they will result in the form of pubic symphysis. इतना पता है. इसी pubic symphysis के ऊपर इसी pubic symphysis के ऊपर you already know we have a muscle, right? We have a muscle, right? And this muscle, okay, now this is the midline. No, yes, now everyone knows that this is the midline, right? This is the midline, and this midline, it is the linea alba, right? This is the linea alba, and to this linea alba, basically a muscle is attached. Can anyone tell me what is the name of the muscle, beta? Anyone tell me the name of the muscle which is just on the sides of the linea alba? Everyone in the chat box, which is on the sides of the linea alba. जल्दी से बताइए. I'm waiting for your answers. Meanwhile, I'm just trying to draw it. Yes. दोनों साइड यही मसल होगी. Yes, rectus abdominis. Very good, Anushka. Very good. It is the rectus abdominis. चलो इतना तो क्लियर है. तो ये दोनों साइड प्रेजेंट होगी ना, राइट लेफ्ट दोनों साइड. पैरामीडियन मसल बोलते हैं ना बेटा इसको, पैरामीडियन. वेरी गुड. कपिल, डिंपल, वरुण, गरिमा, विकी, वेरी गुड बेटा, वेरी गुड. इट इज द रेक्टस एब्डोमिनस. चलो नाउ दिस द रेक्टस एब्डोमिनस मसल. यू ऑलरेडी नो दिस. वेरी गुड. चलो उस साइड भी यही प्रेजेंट होगा. सो यू आर वेरी वेल अवेयर. लेट अस लेबल दिस. दिस इज द, yes, this is the rectus abdominis muscle. Rectus abdominis muscle. Now, this pubic bone, beta, this pubic bone is having a tubercle. Okay, this pubic bone is having a tubercle, and that is called as the pubic tubercle. It is called as the pubic tubercle, right? इसमें small rounded projection होता है जिसको हम लोग क्या बोलते हैं, pubic tubercle बोलते हैं. And we already know we have something which is called as the, from the hip bone, we have something which is called as the anterior superior iliac spine. Anterior superior iliac spine. And from the anterior superior iliac spine, beta, okay, there is a ligament which runs from the anterior superior iliac spine. Okay, I'll just draw it a little nicer. Yeah, वैसे तो ये भी ठीक ही है, oblique ही बनाना है. Can anyone tell me the name of the ligament? Can anyone tell me the, yes, Vicky Chaudhary, very good बेटा, बोलने से पहले आंसर आ गया. So yes, it is the, yes, it is the inguinal ligament बेटा. It is the inguinal ligament. कुछ इस तरीके से जा रहा है, right? It is the inguinal ligament. हाँ, very good, सब सही है. कपिल, very good बेटा. So this is inguinal ligament. And beta, okay, and there is an artery which is just running above. There is an artery which is just running above, okay, and this artery beta, it is called as the inferior epigastric artery. So this is called as the inferior, from the inguinal ligament, like you can very well see, it is the inferior epigastric artery. We have the inferior epigastric vein also, but over here I'm just taking the landmark as the inferior epigastric artery. Inferior epigastric artery. And if you see beta, there is a triangular space now over here present. This triangular space, it is something which is called as the Hasselbachs triangle. So this triangular space which is present over here. Now you guys are going to tell me the medial boundary, the lateral boundary, and the roof of this Hesselbachs triangle in the chat box beta. Multiple times this question has been asked. So yes, फटाफट से बताओ chat box में the roof, the medial boundary, and the lateral boundary. Yes, this is the Hasselbachs triangle. Hasselbach's triangle. चलिए ठीक है, ठीक है, ठीक है. आंसर्स नहीं दे रहे हो, ठीक है, चलो कोई बात नहीं, इसको हम यहाँ पे लिख लेते हैं बेटा. यस, ये ट्राइंगल ना थोड़ा सा इस तरीके से है बेटा, तो ये चीज याद रखना कि हाँ, ये डायग्राम में थोड़ा वैसे ही लग रहा है. तो मीडियली तो आपको, यू ऑलरेडी नो द मीडियली इट इज द रेक्टस एब्डोमिनस मसल. मीडियली क्या प्रेजेंट होगा, रेक्टस एब्डोमिनस मसल, राइट. मीडियली वी हैव द रेक्टस एब्डोमिनस। बेटा लेटरल साइड पे ना ये ना कुछ इस तरीके से है। इफ यू जस्ट सी द इंफीरियर एपिगास्ट्रिक आर्टरी ना, ये कुछ इस तरीके से जा रही है। ये वाली पोर्शन जो है, ये वाला एरिया जो है, दैट इज द वाला पार्ट। सो यस, यू कैन जस्ट ड्रॉ इट लाइक अ लिटिल कर्व, तो इससे थोड़ा सा और क्लियर हो जाएगा। यू वांट मी तो आई कैन ड्रॉ इट लाइक दिस एज वेल। या ऐसे ठीक है, anterior superior iliac spine. So yes, if I just draw it like this, so you guys will have an idea ki what I'm talking about over here. So yes, this will be the base of the triangle beta. ये जो inguinal ligament है ना, ये base बनेगा triangle का। Lateral will be formed by this only. The lateral will be formed by the inferior epigastric artery. So yes, this is the triangle. हाँ, सबके ठीक है आंसर्स, मतलब लमसम तो हमें पता होना चाहिए। सो दिस इज द लेटरल पार्ट। ये लेटरल बाउंड्री बनाएगा बेटा इंफीरियर एपिगैस्ट्रिक आर्टरी, और ये इंग्वाइनल लिगामेंट बनाएगा बेस। इंग्वाइनल लिगामेंट बनाएगा बेस। तो या ये कुछ इस तरीके से है, ठीक है। तो या let us just write it down, let us just write it down. So yes, if we talk about the boundaries, if we talk about the boundaries, firstly you should know the medially it is the rectus abdominis muscle. And which fibers beta? Rectus abdominis muscles. Which fibers? Lateral or medial? In the chat box beta. Lateral or medial? Which fibers of the rectus abdominis muscle? Laterally, it is the inferior epigastric artery. यस अनुष्का, वेरी गुड बेटा। मीडियल तो बिल्कुल लीनिया एल्वा के पास होंगे ना, लेटरल वाले फाइबर्स उसके साइड में होंगे। यस, इट इज द लेटरल फाइबर्स will form the medial boundary, and the base beta. Base it will be formed by the inguinal ligament. Base it will be formed by the inguinal ligament. Base it will be formed by the inguinal ligament. Yes. No, beta, why we have discussed this? What is the clinical importance of discussing this inguinal triangle? Beta, clinical importance is this inguinal triangle may be a site of hernia that is called as the direct inguinal hernia. Okay, direct inguinal hernia, and that just results to the weakness of the conjoint tendon. So we will be discussing in the hernia now. Before starting with the hernia, guys, just give me a thumbs up in the chat box that everything is clear. Yes, everything is clear now. The Hasselbachs triangle boundaries are clear. Just definition and boundaries we have discussed. Floor, if they ask you, the floor it is formed by the transversalis fascia. Yeah, the floor it is formed by the transversalis fascia. Yeah. Yes, everyone is dimple garima kriti. Very good. Very good, Pita. So before the mechanism, let us just now discuss the direct and the indirect inguinal hernia. Now, firstly, we should know what is an hernia. So what is hernia, guys? What is hernia? Very, very important topic. Multiple number of times they have asked. What is hernia? Yes, it is abnormal protrusion. Okay, it is abnormal protrusion of, yeah, it is abnormal protrusion of any abdominal viscus. Okay, any abdominal viscus. Now, when I say abdominal viscus, basically I can say a loop of small intestine. Okay, anything, a loop of small intestine, the visceral part of the abdomen. Okay, a loop of small intestine or a part of greater omentum or anything, right? They come out through a weak part, through a weak part of abdominal wall. abdominal wall. Okay, they come out through a weak part of the abdominal wall. Right, they come out through a weak part of the abdominal wall. Hmm. Now, chalo. Now, now for the hernia to occur, beta use your brains and tell me hernia होने के लिए what are the main two causes that are required. सबसे पहली बात, there should be a defect in the abdominal wall, कि abdominal wall में कोई defect हो, okay, or we have already seen, okay, the physiological hernia and the pathological hernia, right? And the second is the intra-abdominal pressure. Now tell me, what will be the intra-abdominal pressure, increased or decreased? Intra-abdominal pressure ज़्यादा होगा या कम होगा? Tell me. Obviously, it will be. Obviously, it will be more. So, for hernia to occur, yes, increased. For hernia to occur, so you should remember there are two reasons. So there should be a defect presence. Increased होगा. Very good. Presence of defect in the abdominal wall. Presence of defect in the abdominal wall, right? Or secondly, if there is increased intra-abdominal pressure. If there is increased intra-abdominal pressure. If there is increased intra-abdominal pressure, right? Right. So yeah, yes, as in like increased intra-abdominal pressure. Can anyone tell me when the intra-abdominal pressure is increased? In what conditions basically they are increased? Can anyone? At what situations like the intra-abdominal pressure is increased? Anyone? Yeah. Beta, you already know. Yes. Not exactly. Yeah. Not the physiological ones. Beta, the pathological ones. Yeah. Weakening of. नहीं बेटा, अगर मसल्स ही वीक होंगी तो फिर वो कैसे हो जाएगा, प्रेशर कैसे बढ़ेगा फिर बेटा. द कंडीशंस वेयर द इंट्रा एब्डोमिनल प्रेशर इज इंक्रीज, फॉर एग्जांपल लाइक क्रोनिक कफ. ओके, क्रोनिक कफ. Chronic means for a long time. Constipation is there. Chronic constipation or lifting a heavy object. Lifting a heavy object. Yes, lifting a heavy object. So yes, right? So that could be the reasons of the increased intra-abdominal pressure, right? Apart from that, what are the structure of the hernia? Now, basically, beta, coming to this particular picture, you can see that, yeah, you can see that what are the structures of the hernia. Now, if I just want to see that there is a very small opening, beta, small opening होती है जहां से ये बाहर आता है, that is something which is called as the neck of the hernia. That is called as the neck of the hernia. Okay, it is point where the hernia comes out. Okay, now it can be anything, a loop of small intestine that is given. So you can see the narrow constricted part from where the hernia comes out, it is called as the neck of the hernia. It is called as the neck of the hernia, right? Now this, it is covered with, yeah, it is covered with the peritoneum. So yes, you should know that this intestine, it is covered with the peritoneum. Okay, it is covered with the peritoneum. Yes, it is covered with the peritoneum. Apart from that, beta, remember, yeah, it is also, yeah, we have the peritoneum and it is again covered with this abdominal wall structure. Abdomen का वो wall भी तो बाहर आ जाएगा ना, ठीक है? So yes, we have the covering of the abdominal wall also, right? Yes. यस, देखो हर्निया बाहर आ रहा है तो वो जो एंटीरियर एब्डोमिनल वॉल का जो पार्ट है वो भी तो उसके साथ बाहर आएगा. So there are contents of the anterior abdominal wall which hernia has pushed out, which hernia has pushed out, right? So we have like a sac-like structure is there, the neck, the content inside, and the abdominal wall, like which is covering. I mean the abdominal wall covering which is coming out, right? So I hope this is clear to everyone. Now coming on to the inguinal hernia, coming on to the inguinal hernia. So inguinal hernia. Now, beta, try to just write along with me. The inguinal hernia, it is of two types. It is of two types. We will draw and we will learn. Nothing to worry about. Yes, we have indirect inguinal hernia and we have direct inguinal hernia. Direct inguinal hernia. Now, in cases of indirect inguinal hernia, beta, you should remember it is also called as the oblique hernia. It is also called as the oblique hernia. I kindly ask the technical team to block this Karthi. He's constantly disturbing us. So yes, oblique hernia. Now, what is the main difference between these two hernia? Let us just discuss through a very important image, right? So yes, for example, beta, this is the inguinal canal, right? This is the inguinal canal, and we are discussing the inguinal hernia. Now, through this inguinal canal, beta, we already know that yeah, if there is protrusion of yeah the intestinal part going from the deep inguinal ring. Yes, yes. So yeah, it is covering throughout. Okay, it is an oblique hernia because direction of the inguinal canal is also oblique, right? So the intestinal contents are coming out. The intestinal contents are coming out. Okay. So yeah, that is something which is called as the oblique or indirect inguinal hernia. Okay. So the intestine goes from the deep inguinal ring to the superficial inguinal ring. I don't need to actually tell you guys that this is the deep inguinal ring. Till now, you are very well aware with the fact that this is the deep inguinal ring and this is the superficial inguinal ring. So if this is a loop of intestine, it is going from the deep inguinal ring and coming out from the superficial inguinal ring. Okay. Okay, okay, right. So yes, apart from that, if we talk about the direct inguinal hernia, now when I say direct, beta, so suppose this is the inguinal canal. Now this is the inguinal canal, right? So this is inguinal canal. You already know inguinal canal. So if it's a loop of small intestine, loop of intestine, it is coming directly, obliquely from the deep inguinal ring to the superficial inguinal ring. तो ये indirect inguinal hernia है. Direct में क्या होता है बेटा? Direct में क्या होता है? If suppose this is the okay. Now beta direct what will happen? There will be okay. Now there will be direct the posterior or we can say the posterior abdominal wall. Okay, the posterior abdominal wall. Okay, if or see if the intra-abdominal pressure is increased. Okay, if the intra-abdominal pressure is increased or there is a weakness of the anterior abdominal wall. Okay, so what will happen? They will like push this inguinal canal, and what will happen if this wall is not there? What will happen? This wall will create an opening. This wall will create an opening, right? अब पहले वॉल में कोई डिफेक्ट नहीं था, ओके, the walls of the inguinal canal were perfectly okay in the first case, but in the next case, the walls are actually ruptured due to the increased intra-abdominal pressure. Due to the increased intra-abdominal pressure. Okay, so yes, and through this beta, the contents are like coming out. To this, the contents are coming out. For example, the intestine, a loop of intestine maybe. Okay, so here the walls are intact. The walls are already intact, but it is the protrusion is through the deep inguinal to the superficial. That is indirect. When the pressure is so much there, intra-abdominal pressure is so much there, it damages the walls and the content of the intestine comes out. That is something which is called as the direct inguinal hernia. Okay. Now, if you just want me to write, क्या बेटा इतना क्लियर है? फटाफट से एक थम्स अप दे दो चैट बॉक्स में. फटाफट से एक थम्स अप दे दो चैट बॉक्स में. अच्छा, इसके अलावा बेटा एक चीज बताओ, एक चीज बताओ, क्या जो अगर इस इंग्वाइनल रिंग की अगर मैं बात करूं, okay, you already know the posterior wall, it is made up of fascia transversalis. Fascia transversalis. In which case the fascia transversalis will come out? Indirect or direct? In which case the fascia transversalis will come out? Indirect or direct? देखो, posterior जो wall है inguinal canal की, if it gets ruptured due to increased abdominal pressure, okay, very good सत्यश्री, it is direct वाले में आएगी ना, because posterior wall जो है बेटा, ये जो posterior wall होती है, मैंने आपको पहले ही बताई थी वो किसकी बनी हुई है, it is made up of fascia transversalis, है ना. हमने देखा था posterior wall of the inguinal canal, अभी थोड़ी देर पहले पढ़ा था, right? Now, if there is an increased pressure on this posterior wall, what will happen? The wall will break and the contents of the loop of the intestine will come out through this loops, I mean through this hole. So along with the intestinal loop, this fascia transversalis, the part which has been damaged, it will also come out. So in the indirect oblique hernia, there will be no fascia transversalis coming out. But in direct, you can see the fascia transversalis coming out. Right, right. Everyone is right. I hope it is clear now, Kapil. I hope it is clear now. So you should know if we talk about the cause beta, cause is, yeah, over here the cause. Over here the cause. Okay, chalo. फटाफट से let us discuss the cause beta. So the cause over here, it is increased intra-abdominal pressure. Okay. Now, इंक्रीज्ड इंट्रा एब्डोमिनल प्रेशर. अब बेटा यहाँ पे भी एक वो चीज है कि इंट्रा एब्डोमिनल प्रेशर जो है, दिस इनडायरेक्ट इंग्वाइनल हर्निया इट इज सीन इन चिल्ड्रन. बेटा चिल्ड्रन में क्या होता है, ये जो कैनाल है ना, इंग्वाइनल कैनाल, इट इज समवॉट स्ट्रेट, नॉट एग्जैक्टली स्ट्रेट, इट इज समहाउ स्ट्रेट. एंड ऑब्वियसली अगर इंट्रा एब्डोमिनल प्रेशर बढ़ेगा तो स्ट्रेट चीज है, स्मॉल इंटेस्टाइन का लूप वैसे ही बाहर आ जाएगा, इट विल कम आउट एज इट इज, राइट. So yes, so it is more common, indirect inguinal hernia, it is more common in children, right? So yes, increased intra-abdominal pressure. Now when we say direct inguinal hernia, now if this is seen in children, now can anyone tell me that direct inguinal hernia, it will be seen in which age beta? Which age it will be seen in? So it is due to the weakness of the anterior abdominal wall. Yes, obviously it is weakness in the anterior abdominal wall plus increased intra-abdominal pressure plus increased intra-abdominal pressure, right? So it is common in old age. It is seen in old age, okay? It is seen in old age. Obviously, it is seen in old age. Apart from that, beta, apart from that, yeah. What are the coverings that you will find? बाहर जो content निकला है, what are the coverings in the indirect, okay, indirect inguinal hernia and direct inguinal hernia? What will be the coverings that you will encounter? That is something that you have to remember. You will have the skin, superficial fascia will come out, superficial fascia, right? Then we have external spermatic fascia. ये मुझे बताने की भी जरूरत नहीं है तुम लोगों को. External spermatic fascia, cremastic muscle and fascia, okay? Internal spermatic fascia, and we have extra peritoneal fatty tissue. We have extra peritoneal fatty tissue, right? But in the direct beta, in the direct one, you will get the skin, superficial fascia, okay? External spermatic fascia. I'll show in the diagram also. Okay. Then we have, okay, cremastic muscle, cremastic muscle and fascia. Then you will not get internal spermatic fascia beta over here because there is a defect in the wall over here. So here we will have only one difference, that is fascia transversalis, fascia transversalis, okay, and the last one remains the same, that is extra peritoneal fatty tissue, extra peritoneal fatty tissue. Now beta, let us look at this image beta. I have taken one image. Let us just try to look at this. Let us just try to look at this image and learn. Now, you guys already know we, okay. Now beta, everyone can see this sac of hernia. This is the sac of the hernia which is coming out. This is the sac of the hernia which is coming out. Can anyone tell me from outer to inner all the layers? Like you can very well see we have the external spermatic fascia, internal spermatic fascia. Can you tell me this yellow color? This yellow color, what it will be? This yellow color, what it will be? Yes, this yellow color, what it will be? हाँ, हाँ. Yeah, very good dimple D, extra peritoneal fatty tissue, extra peritoneal fatty tissue. ठीक है, तो इस कंटेंट के साथ साथ ये सारी चीजें आ रही है, स्किन आ रहे हैं बाहर से, सुपरफिशियल फेशिया है, ठीक है, यस सुपरफिशियल फेशिया है, राइट. नाउ बेटा ओवर हियर इफ यू सी इन द डायरेक्ट केस, तो डायरेक्ट वाले केस में बेटा मैंने तुम लोग को बताया था, दिस intestine, it is actually coming onto the walls of the anterior abdominal wall. ये I mean it is coming onto the anterior abdominal wall and it is damaging it. मसल लेयर तो नहीं आएगी ना, फिर इसके साथ ये क्या प्रेजेंट है, फेशिया ट्रांसवर्सालिस, fascia transversalis will come out, right? So that is what you can see over here, right? या fatty tissue है peritoneum, हाँ ठीक है. तो पिछले वाले केस में क्या था, इट इज कमिंग जस्ट थ्रू द वे ऑफ दिस इंग्वाइनल ओपनिंग ओनली, सुपरफिशियल इंग्वाइनल रिंग, डीप इंग्वाइनल रिंग से आया सुपरफिशियल इंग्वाइनल रिंग. सो ऑल द कंटेंट्स ऑफ द स्पर्मेटिक कॉर्ड विल बी देयर, एक्सटर्नल स्पर्मेटिक फेशिया, इंटरनल क्रीमास्टिक मसल, ठीक है. सो यू कैन इजीली सी इट ओवर हियर आल्सो. इट इज नॉट very clear, yeah, but all the layers will be present from outside to inside. Over here this is coming like this, this is coming like this, right? I hope this is clear to everyone. I hope this is clear to everyone beta. Indirect and direct inguinal hernia, the Hasselbachs triangle, the constituents of the spermatic cord, The boundaries of the inguinal canal. Yes, just give me a thumbs up, guys, that everything is done. चल बाकी जो टॉपिक्स रह गए थोड़े बहुत, that we will complete tomorrow. And believe me, guys, I will be starting with the stomach soon, like day after tomorrow. Tomorrow I will discuss the, yeah, I will discuss the mesentery part is left, peritoneum is left, I suppose. Peritoneum is left. That I will be discussing up tomorrow. After that, I will be like focusing on, yeah, all the organs: stomach, liver, pancreas, spleen, duodenum, everything we will discuss in detail, guys. Okay. I will like take one lecture for each of the organs as well, because we nowadays the questions are very conceptual, so you need to understand everything. Okay. So yes, hindgut beta, hindgut Kapil, yes, hindgut I will be discussing when I will discuss the pelvis portion, right? So in that, yeah, MCQ session भी कर लेंगे fun mode, no worries. MCQ session I will also do. I will give you a Q bank also on the question. I mean on my Telegram group. If you want, you can practice from your side. Just remind me on my WhatsApp. So I'll give you a Q bank also. Nothing to worry about, beta. So yeah, I'll discuss it. I'll give clinical cases only, because nowadays they are not asking like simple वाला concept तो नहीं आता है, मतलब थोड़े बहुत रहते हैं, 10-20% रहेंगे, बाकी तो 80% clinical. I'll try to put some clinical questions. And whatever, I mean, everyone I suppose is writing the notes along with me. Whatever notes I'm discussing, everyone is writing, I suppose, with me. Yeah. So हाँ, हाइंडगट बेटा उसी के साथ डिस्कस करेंगे जब मैं पेल्विस वाला पोर्शन पढ़ाऊंगा ना. Then I'll have a discussion on the hindgut. No need to worry. Okay, perfect, beta. If you're making notes, that's absolutely perfect. So yes, so to attend the sessions tomorrow, like every day there will be a new topic in abdomen. So beta, remember I have discussed the abdomen in detail, guys. Whatever points I can discuss, even after drawing the diagram for you people, I have made all the content written, okay, simultaneously in your notes. Like I'm writing along with you so that it's way clear for you people to know, write and learn, right? Draw and learn. तो यही नहीं है कि डायग्राम बनवा के छोड़ दिया, आप जस्ट, या तो साथ साथ में नोट्स भी लिखे हैं. यस, वी आर मेकिंग नोट्स. ओके ओके, ठीक है. तो जस्ट फॉलो व्हाट आई से, राइट? So we'll meet tomorrow at the same time. Okay, bye.